This Focus on Health segment is brought to you by Aurora Healthcare.
If you happen to be in the hospital and see a furry head or two poke around, don't be alarmed. You may see Misty or Oliver here at Aurora Medical Center in Oshkosh doing pet therapy. It's a wonderful program here at Aurora Medical Center. Today at Aurora, a national pet magazine called Pet Buzz is here to highlight the program for a future issue. We'll be talking with pet handlers, and we're going to start our conversation with Becky Christensen. We are now here with Becky Christensen. Becky, thanks so much for joining us.
You're welcome.
This is such an interesting and unique program, Pet Therapy. Can you tell us a little bit about why this program is so special?
We started pet therapy here at Aurora because we ran some focus groups, and this is what patients want. When we walk around the hospitals and clinics, we just see the faces light up, not only on patients but staff, family members, and we see a big difference.
What a wonderful program. Do you notice, what kind of changes do you notice in the patients from the beginning to the end of this pet therapy?
Well, we just had evidence of that a few minutes ago. There was a woman who could barely speak. She is in intensive care unit, and she happens to be somebody that I know, so I went and talked with her about possibly having the therapy dog come in. She was very non-responsive, and then as soon as the dog came in, she lit up and she nonstop talked. It was just a tremendous change.
It's wonderful. And what types of patients do you use these animals on?
The therapy dogs go to the pediatric area quite often if we have pediatric patients. Also rehab. It helps stroke patients. They'll reach for things. They'll try to throw the ball to the dog, things like that.
Okay. And how do you become a pet therapy dog? Or is it just dogs, I guess?
For now, yes, it is just dogs. They are all certified by outside agencies. There are several agencies. Once the dog is certified, then the handler comes and becomes a volunteer with us, and the dog becomes a volunteer with us.
Okay. And how long has Aurora been doing this?
This will be our 5th year now.
Okay, very exciting.
Just at this site alone.
Okay, and you were talking about some of the handlers, and I think we're going to step over there and see what they're doing with their dogs.
Okay,
thank you. We are now with Jim and Justin and Misty and Oliver. These are two of the owners of these wonderful dogs for pet therapy here at Aurora. And Jim, thanks so much for joining us.
Well, you're very welcome.
We were talking earlier. Why don't you tell us a little bit about how you became a pet therapy handler?
Sure. When I retired from the police department in Fond du Lac, I had heard about therapy dogs, and I went and bought a puppy with the explicit purpose of making a therapy dog out of her. And I checked the family, the both parents of the dog, to make sure that they were calm dogs and good-looking dogs, and I took it right from the start.
Well, you do a wonderful job with Misty, and I understand that Misty is exclusive here at Aurora.
Yes, she is. I've been coming here for a little over 2 years now. I've been to nursing homes and hospice homes and various other locations with the dog, but I've kind of fallen in love with this location here because I have so much freedom with the dog to go to so many different areas of the hospital.
And I see on Misty's name tag she's an award-winning pet therapy dog here, and she's a certified volunteer.
Yes, she is. She's a registered therapy dog.
Registered, okay.
That means you have to train them yourself, then you have to get the dog tested, and they put it through a very rigorous demeanor testing and how it behaves around other dogs, and do various other things to make sure it's a calm dog. And the dog's not allowed to do any barking or jumping on people or anything like that. Any slip-ups like that, and they won't pass the dog.
Well, and I guess they also have to go to a special volunteer program with John Neiman, the volunteer coordinator.
Yeah, you have to learn the rules and regulations of the hospital and the clinic and observe all of their restrictions.
Now, is there any special times that these dogs can go see patients, or is it whenever the patient needs the dog to come in?
Yeah, any time of the day or night at this location, you could bring a dog in here for pet visits.
Okay. Do you have any special moments that mean a lot to you that happen?
I've had many special moments, even at this location, over the last couple of years. between the children mostly. They're so tense, when they get injured or something. I've noticed a lot with the children. And Cancer Treatment Center is a very positive area.
I suppose. And what a great thing to have a dog come in and just make your day.
It certainly is.
Well, thank you very much. I think we'll pass the mic over here to Justin. And Justin, tell us a little bit about your dog. You have Oliver here.
Yeah, this is Oliver, a Boston Terrier with a nice brindle coat. He just got certified about a month ago from Therapy Dogs Incorporated. So we're just starting the program with him. He's our third therapy dog in the family.
Oh, so you've been doing this for a while?
I have, on and off. My sister's been the main one who did it, and my father before. So.
Okay, great. And how old is Oliver?
He's about 18 months.
Have you done many things with the program yet with him? You said just...
We just started. We were planning on doing a lot more once, we get into the swing of things and get everything rolling. But yeah, I'm looking forward to working with Aurora, and, hopefully Oliver does too.
Well, that's wonderful. And you guys have such wonderful dogs. They're doing a great job here. And now we're going to talk with such an exciting time. The Pet Buzz magazine is also here at Aurora, and they're doing a special story. And we are going to talk with Shirley in just a moment. We are now here with Shirlie Rae from Pet Buzz magazine, a national magazine that has came to Oshkosh, to Aurora Medical Center, to see what this pet therapy is all about. Thank you so much for joining us.
You're welcome. It's nice to be here.
So what do you think about this program here at Aurora?
This is a wonderful program. The program with the children especially, it's teaching them that these dogs can be raised to do something that's positive. The mission of Pet Buzz magazine is to promote positive owner-pet relationships, and we're also on the bandwagon to help fight pet and animal abuse. And if this isn't a prime example of how these dogs can interact and relate with patients and the community, just working, and the owners are raising them properly. They're beautiful dogs. Yeah.
It is a wonderful program. And if anyone would want information about your magazine and the story that you're doing, can they just log on to your website?
www.petbuzzmag.com.
Okay.
Misty and Oliver are wonderful examples of what we can do to raise dogs and what their purpose is. The example that Becky gave earlier, that the woman in ICU really was unresponsive, and I couldn't believe the difference by the time we left there, exactly what happened.
It's amazing what a quick change that can happen to. That's wonderful. Well, thanks so much for coming to Oshkosh and coming to Aurora. I look forward to reading the article.
Thanks.
Volunteers don't have to be a hospital or Aurora employees. Anyone who is interested can contact the hospital at 456-6000 and ask about the pet therapy program. You can also log on to the web at www.aurorahealthcare.org. We'll be back with more of Oshkosh Today right after this.
This Focus on Health segment has been brought to you by Aurora Healthcare.